Improving timely health care for children and youth in foster care, getting started on quality improvement. Hello, I'm Jane Taylor, a Quality Improvement Advisor. Children and youth in foster care are among the most vulnerable children, and many have high rates of physical and behavioral health care needs. A variety of services and strategies exist within Medicaid to address the unique healthcare needs of children and youth in foster care. A timely and comprehensive health assessment after entry to foster care helps to identify children's needs and is especially important for ensuring healthy outcomes. In this video, I will share quality improvement methods that will help you get started on a program to improve timeliness of comprehensive exams to identify needed health services for children and youth in foster care in your state. A great way to begin any quality improvement project is with an aim statement, stating what you want to improve. An aim statement identifies key parts of your project. What do you want to achieve? Who is your population of focus? How will you measure improvement? By when do you want to see improvement? A good aim statement will help keep you and your improvement partners working together towards the same goal. Here is a sample aim statement on improving timely completion of the comprehensive health assessment for children in foster care. By a specific date, the state Medicaid and CHIP program will increase the number of children in foster care who receive a comprehensive health visit within state guidelines from a baseline percentage to an increased percentage. The aim statement anchors the beginning of the driver diagram. A driver diagram is a quality improvement tool which organizes evidence-based processes or systems that can drive the change needed to help you achieve your aim. The next step in creating a driver diagram is to identify the primary drivers. These are the key processes, structures, or norms in your system that need to be considered to achieve your aim. For example, one of the primary drivers for improving timely health care for children and youth in foster care, highlighted here, is coordination of services. Secondary drivers are the places, steps in a process, time-bound moments, or norms that identify the opportunities to produce improvement in the primary drivers. The secondary driver highlighted here is coordination of roles and activities across staff in child welfare, Medicaid, and Medicaid managed care. Secondary drivers lead to change ideas. Change ideas are activities supported by evidence, experience, or expert opinion, and are the ideas that we test as part of a quality improvement project. Building off the success of others will help achieve your aim. Another tool that may help your team identify potential change ideas is a process flow, which is a visual display of the steps in a process. Seeing all the steps that are part of your current process can help you see what happens between the beginning and the end. You may find processes that are taking too long or not happening at all. A process flow helps you see opportunities to improve the process and in turn realize your aim. You will find an example of improving timely health care for children and youth in foster care driver diagram and a change ideas table, as well as other resources on Medicaid.gov. How can you get started on a change idea for your Medicaid and CHIP program? Although it may be tempting to go big, making a change for the whole state, it's best to start small and test your way into the most effective program and policy improvements for your state. Using small tests of change will enable you to determine whether an idea will lead to sustainable improvement in your program and for your beneficiaries before enacting policy changes. An effective tool for testing change is the Plan, Do, Study, Act, or PDSA cycle. The PDSA cycle helps you learn whether a change idea will work for circumstances in your state. Let's plan a PDSA cycle, or Plan, Do, Study, Act cycle, by testing an idea from the driver diagram and change ideas table on improving timely health care for children and youth in foster care. We will begin with the secondary driver we highlighted earlier, coordination of roles and activities across staff in child welfare, Medicaid, and Medicaid managed care, and then review and select an idea from the change ideas table. Some states have developed detailed checklists to support child welfare staff in coordinating with Medicaid, managed care plans, and the child's primary care provider to schedule and ensure timely completion of the comprehensive health assessment. Let's start with that. The first step is to plan. Start by asking, what questions do you want to answer with this small test? For this PDSA, your question might be, will providing child welfare staff with a detailed checklist improve rates of timely completion of the comprehensive health assessment? Next, decide what you will test. Who will conduct the test? The subject of the test, and what tools or resources are needed to complete the test. One of the most important elements of the plan section is to identify what data you will gather to learn whether the idea has promise, did it work or not. Keep the data collection simple and quick. Try not to use administrative claims or other data with lag periods. The data don't have to be perfect. You just want to learn quickly whether and how the small test worked. Finally, make a prediction. What do you think will happen as a result of your PDSA? Making a prediction will enhance your learning. When you have completed your plan, you're ready to do or conduct the test. In our example PDSA, did Oliver, Emma, and Charlotte use the checklist on 10 children entering foster care? Next, study the data to understand the results of your test. Did your test go according to plan? What did the data tell you? How did your predictions compare to what happened? What surprised you? The final phase of the PDSA cycle is to act on what you have learned from the test. In most cases, this means planning the next iteration of your test based on what you have learned. For example, in the next PDSA cycle, test how to remove a barrier that you learned about. Or you can test the change idea with a different population, in a different setting, or with more providers or beneficiaries. You could even test several things by doing concurrent PDSA cycles. In our example of a PDSA cycle, 3 staff from the State Child Welfare Department were provided with a checklist to use with the next 10 children entering foster care to facilitate enrollment into managed care and scheduling the comprehensive health assessment. PDSA data showed that these children were more likely to have their comprehensive health assessment completed within the state's timeliness guideline of 30 days from the date the child entered foster care. From the first PDSA cycle, the team learned that providing checklists to child welfare staff was a successful change idea that helped to increase timely completion of the comprehensive health assessment. However, one of the child welfare staff was not aware of the process for referring these children to care managers at the managed care plan for scheduling support. For the next PDSA cycle, the team decides to test using a revised checklist that includes contact information for managed care staff and target timeframes for completing specific steps in the process. For example, child welfare staff should notify managed care staff to begin outreach within 5 days of entering custody. You also decide to include 2 more child welfare staff, along with the 3 initial staff that participated in the first iteration of the test. You hope to learn whether this enhanced checklist will result in getting the comprehensive health assessment scheduled and completed within 30 days for more children. Remember that testing ideas concurrently will accelerate your progress. Continue testing and learning about your change ideas by addressing barriers to improvement and over time increasing the size of your tests. For example, if you started by including 10 children, test next with 25 and then 125. As you conduct your PDSA cycles, create run charts to visualize your data. A run chart is a graph that shows performance on a process or outcome over time. Run charts often show data in week or month intervals. Displaying data over time will show you the impact of your change idea and whether it is producing the desired results. The run chart shown here captures the data from our PDSA cycles. From the local child welfare office's baseline of 60% timely completion of the comprehensive health assessment, the first test using the checklist demonstrated improvement. Improvement continued as PDSAs were carried out and the checklist process was revised and expanded to other child welfare staff, contributing to meeting the department's goal of 85%. When you have confidence that your change idea will reliably improve timely completion of the comprehensive health assessment, you are ready to implement it broadly in the system where you conducted your testing. Good implementation requires getting buy-in from leaders and others involved, including the people receiving the benefit. You will want to make sure that the cost of failure, either financially or in terms of the goodwill of your partners, is low. Broader implementation might require changes in behaviors, policies, or procedures, and might include training staff and securing more resources. After successful implementation, you're now ready to create a spread plan, a plan for expanding beyond the initial setting or population you tested into new settings or populations. As you expand, continue to collect data and monitor progress to make sure your change idea continues to have impact and the outcomes are sustained. What I've presented here, identifying an aim statement, developing and conducting PDSA cycles, and implementing and spreading change ideas, is called the model for improvement. It's one of the best ways to transform ideas into strong programs and policies for Medicaid and CHIP beneficiaries. To learn more about the model for improvement and to request quality improvement technical assistance for your state's Medicaid or CHIP improvement project, reach out to CMS through the Quality Improvement Technical Assistance mailbox. That mailbox is Medicaid CHIP QI at cms.hhs.gov. For more information and additional resources, scan this QR code to go to the Improving Timely Healthcare for Children and Youth in Foster Care Quality Improvement Technical Assistance webpage. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense.